What's that one thing which most girls, women, and nowadays even guys fear the most? Obesity or looking fat. It's not just due to the cosmetic reason, but it is also related to the increasing awareness about health. We are always bothered about how to lose weight, the different type of diets, and what are the exercises which will help us in reducing this obesity. We hardly bother to find out what causes this obesity, what are the consequences of obesity, which if not treated in time will lead to serious consequences. Let's understand this obesity, its causes, its consequences in this video in detail. Hi, this is Dr. Parag Sanghvi, founder Be Your Force, your holistic life coach and your health and wellness life coach. Obesity is a chronic, long-standing disease where there is abnormal and excessive accumulation of fatty tissue, that is the adipose tissue. WHO, that is World Health Organization, defines obesity as one having BMI greater than or equal to 30 and overweight as one having BMI greater than or equal to 25 and less than 29.9. What is this BMI? BMI is body mass index and it's calculated by dividing the weight in kilograms and square of the height in meters. In children, the way of describing obesity or calculating obesity is different. It is calculated by comparing the percentile weight in the same age group. Worldwide, there is a high prevalence of obesity. The 2016 study conducted by WHO shows that 1.9 billion adults above 18 years of age had overweight or obesity problems. Out of that, 650 million adults were obese. From 1975 to 2016, the numbers of overweight and obese people had tripled. It's like an epidemic. And the number of children affected by this overweight and obesity problem was as high as 41 million. 340 million children and adolescents between the age of 5 to 18 were obese in 2016. Did you know that overweight and obesity were more linked to deaths than underweight worldwide? Initially, obesity was thought to be a high-income disorder, but nowadays even low-income and middle-income countries are showing increased prevalence of obesity and overweight. Maybe this is related to the increased amount of usage of junk food and processed food. When the food you eat provides more calories than the body needs, the excess is converted into fat. Initially, the fat cell size increases. Once its expanding capacity is reached to its maximum, then the number of fat cell increases. At the micro level, there is an abnormal and excessive deposition of adipose tissue or fatty tissue. Obesity plays a central role in the pathophysiology of atherosclerosis, dyslipidemia, increased blood pressure, diabetes, and insulin resistance. In obesity, there is a secretion of adipokines, which are signaling proteins, which plays an important role in the dysfunction of the glucose and lipid metabolism. It also plays important role in the dysfunction of cardiovascular, respiratory, gastrointestinal, immune system. Obesity also acts as a major risk factor in many cancers, both in males and females. Inactivity, lack of exercise, unhealthy diet and eating habits are the most commonest causes of obesity. Besides this, family lifestyle, emotional factors and socio-economic factors also play an important role in contributing towards obesity. Obesity tends to run in particular families because of their way of living, because of their diet and because of their eating habits. Socio-economic status, few countries with a higher income group, they were thought to be contributing to obesity, but the recent study shows that even low and mid socio-economic countries, especially in an urban setting, are more prone for obesity. Emotional factor, person having depression tends to eat more, shows habit of binge eating and thus contributes to obesity. Certain medical conditions like Cushing's disease or polycystic ovarian syndrome are known to contribute to obesity. Certain drugs like steroids, antidepressants are known to be the cause of obesity. And lastly, sleep also plays an important role in obesity. Sleeping less or oversleeping causes changes in the hormones which are responsible for controlling your appetite and for controlling your inner cravings for carbohydrates and fats. Adequate sleep helps in losing weight, and thus deprived sleep leads to obesity. Obesity increases the risk of diseases related to most of the organs and systems in our body. It increases the risk of coronary artery disease, hypertension, atherosclerosis, obesity associated cardiomyopathy. In respiratory system, it increases the risk of obstructive sleep apnea. It increases the risk of bronchial asthma and also makes the respiratory system susceptible to infections. It also increases the risk of stroke. As far as reproductive system is concerned, it increases the chances of developing anovulation and polycystic ovaries, which are the causes of infertility. As far as the gastrointestinal tract is concerned, the incidence of gallstones and gallbladder cancers are more. The incidence of reflux esophagitis increases in people who are obese. Stress incontinence is more common in people who are obese. The incidence of osteoarthritis increases in obese people, especially osteoarthritis of the hip and knee joints, because there is increased load bearing. Even chronic backache is common in obese people due to excessive load factor. As far as the metabolic or endocrinal system is concerned, the chances of developing type 2 diabetes, the chances of developing dyslipidemia, the chances of developing metabolic syndrome increases many folds. Chances of breast cancer, endometrial cancer, gallbladder cancer increases in obese women, and the chances of cancer of the colon and prostate are more in obese male. Finally, obesity is related to psychological conditions due to social stigmatization. It is also related to depression. Obesity can lead to depression, and depression can lead to overeating, binge eating, and thus lead to obesity. So you understand, obesity is directly or indirectly related to so many medical conditions. It becomes imperative, it becomes very important that we understand the significance of obesity, the causes of obesity, the consequences of obesity, and then we can take proper steps to deal with obesity. How do we deal with obesity? We shall talk about in our another video, in the next video which will be coming soon. This is Dr. Parag Sanghvi, founder Be Your Force, your holistic life coach and your health and wellness life coach, signing off. Thank you.